My name is Shubham Chaudhary. This is my student ID. My student ID is 9917277085. I'm going to show my surrounding. 360. And I'm going to set it up. Yep. Here you go. I'm going to perform my hand hygiene and I'll start with my verification check. Before we begin, I'll just show this is my doctor's order. This is my MAR. So I'm gonna do my verification. I have a supplies. This is my drug card. Here is my medications, and here my other supplies is what I need for the assessment. I perform my hand hygiene. Start with the verification check. Fiona Sherrick. February 25, 1980. February 25, 1980. My patient is diagnosed with laboratory small bowel resection sepsis. Diagnosed with the laboratory small bowel resection sepsis. Patient doesn't have no known allergy, no known drug allergies, and I'm giving pantoprazole 80 mg IV. I'm giving pantoprazole mg through IV. I'm done with my verification check. Now, before I begin my first check, I have checked that my medication is not expired. Patient is not allergic with my medication, and my medication is compatible with normal saline. So my compatibility test my compatibility safety check is over there. Now I'm gonna start with my first check. For my first check, I'm gonna bring out my medication bin. I'm gonna go for Fiona Sherrick, right patient. I'm gonna get pantoprazole, right medication, 80 mg, right dose. I'm giving through IV, right route, and I'm giving 1000 hours right time, and I'm giving twice a day right duration, right frequency, and I'm giving because my patient is diagnosed with the sepsis. This medication helps to prevention of stress ulcer and GI bleeding. So I have a right reason over there. Now I'm gonna calculate my dose, what I have to give. So I've calculated, and I have to draw 2 ml of my medication, and here is my piggy bank. I've also checked my piggy bank is not expired and it's ready to use. Now I will start with my second check. I'm gonna do Fiona Sherrick, right patient, Fiona Sherrick, pantoprazole, right medication. I'm giving 80 mg right dose. I'm giving through IV, right route. I'm giving twice a day, right frequency. I'm giving 1000 hours right time, and I'm giving because my patient is diagnosed with sepsis, and this medication helps to prevention of stress ulcer and GI bleeding. So I have a right reason over there. On my second check, now I'm going to use my blend needle. I'm going to use brand new, and I'm going to open it. I have a 3 ml of syringe because I have to draw 2 ml. So I'm going to open my vial. This is brand new. If it's not, I'm going to alcohol swap it, let it dry for a bit, and then I'm going to draw 2 ml of air, and I'm gonna inject that into the medication. Now I'm gonna use scooping method. And let get out with all the bubbles. Yeah. I draw a little bit more so I can get away with the bubble and I get my correct dose. There you go. I showed to the camera. I've confirmed that it's 2 ml. Now I'm gonna use my piggy bank. I'm gonna alcohol swap it, and I'm gonna inject it, let it dry, and then I'm gonna inject my medication slowly into my piggy bag, and I'm gonna use scooping method. and this will go into the sharp pen. Now I'm done with this. I'm gonna gently mix my medication. Now I'm gonna label it. I have written all the thing, and I'm gonna label it my medication then piggy bag, and it's ready. Now I'm done with my second check. Now I'm gonna go to the patient, and I will perform my further evaluation. For that, I'm gonna do further assessment for knock, hand hygiene, privacy, safety check, brakes check. I have my mark. Hi Miss Fiona, my name is Shubham Chaudhary. I'm a practical nursing student from the Sheridan College. May I know your name and date of birth? I've confirmed her name and date of birth. Fiona Sherrick, February 25, 1980. It's confirmed. Miss Fiona, I'm here to give you your pantoprazole medication, 80 mg through IV. Is it okay with you? She said yes. I got her consent. Before I leave, I've already checked her IV side. Her IV side is well intact, connected. There is no leakage, and there is no bubble as well in the tubing. My primary lining is running properly. No bubbles in the tubing and no kinkings, and my patient doesn't have any pain. There is no specific signs of infiltration, phlebitis, and infection. For infiltration, there is no swollenness, no coldness, and no signs of erythema. For phlebitis, no redness, no warm scale, and no warmness, and no signs of edema. For infection, there is no signs of fever and no tachycardia. So my patient doesn't show any signs. She doesn't also have any pain. That's really good. So Miss Fiona, I'll get my resources and get back to you within a minute. Now I'm gonna perform my third check. For third check, I'm gonna do the Fiona Sherrick, right patient, pantoprazole. I'm giving the right medication. I'm giving 80 mg, 2 ml of medication, right dose. I'm giving through IV. So right route, I'm giving twice a day, right frequency, and I'm giving 1000 hours right time. And I'm giving because my patient is diagnosed with sepsis, and this medication helps to prevention of stress ulcers and GI bleeding. So I have a right reason over here. I'm done with this. Now I'm gonna go to my patient and educate her about this medication. Hi Miss Fiona, I'm giving this medication, pantoprazole, is because you diagnosed with the sepsis, and this medication helps you to prevention of stress ulcer and GI bleeding. This medication has certain side effects like headaches, diarrhea, nausea, flatulence. Do you still want it? She said yes. And so right patient education and right to refuse. Now she said she gave me consent, so I'm gonna grab my other supplies, my secondary tubing and my piggy bag, and I'm gonna use my alcohol swab. I'm gonna clean it, and let it dry for a bit. I'm gonna inject this. I'm gonna do back priming with back priming. I'll make sure that this is still halfway through. This piggy bag medication is brand new. I'm gonna open it. I'm gonna spike it slowly. Yeah. I'll make sure primary bag will go down. It will go up. So this medication can go first. I'm gonna do channel select. I'm gonna go secondary. I'm gonna search out for pantoprazole. I selected pantoprazole. I selected yes. I'll go next. Here is according to my calculation, I have to select 1 hour, and I'm gonna change my volume to 100 because I have to give this medication 100 ml per hour. So I've selected, and it is 80 mg, and I've calculated all the thing manually as well. So it's ready to go. I'm gonna press start, and yes, and it's running properly. I'll make sure that both the clamps are open so my medication can go through. Pantoprazole is running properly, 100 ml. So yep, I checked the secondary line, and secondary line is running without any problem. Now I'm gonna go to Miss Fiona. Miss Fiona, thank you so much for your cooperation. I gave you, I'm gonna document that I gave you medication, and I will get back to you within half an hour and evaluate you. So write documentation and write patient evaluation is over here. If you need any help in between, you have a call bell next to your hand. You can call me, you can press it and you can get help anytime. Do you have any question for me before I leave? She said no. So I said thank you, and the bed will be at the lowest position. And thank you so much. I'm done with this. Now I'm gonna answer my critical thinking question answers. So my question was, what are the three main reasons which are important for reconciliations for patient safety? So first is it helps to prevent medication error, reduce harmful interactions by identifying allergies, ensure accurate medication list during admission, transfer and discharge. So this is my answer. Thank you so much, and now I'm gonna give her privacy, and that's all. Thank you.